Yeah. Good evening, everybody. I think hopefully we would have made some progress from the previous meeting. Um, so, Ainas, you can start. Hello? Hello, Ainas? Ainas, are you there?
She's on call, I think, sir. She hasn't logged in. Shall I go ahead with others?
Yeah, go ahead
We'll
with
come back to
others.
her, sir.
Yeah, okay. So, let's start with Samir then. Samir?
Yes, sir. Sir, regarding this appendix cases, sir, 35 cases I have data I have collected, sir.
Ah,
The nurses versus doctors notes, this pilot thing, sir, I have done with analysis.
ah,
Yes, sir. Ma'am, can you show
yeah,
the...
share the thing.
1 second, sir. I'm sharing. Can you see?
Yes,
Samir,
ma'am. Yes, sir.
Samir, what you need to do is you have shared the protocol with Dr. Lakshman and with Nishant and everybody,
Yes, sir.
because we have now got, MD has said okay to that we can do all that.
Uh,
So
from
share the
Shanti
thing.
also I have collected, sir.
Yeah, and make sure that you go and collect the data. If you inform sir, there he will get somebody to make sure all the data points are collected. Then, but it is your responsibility to go and fill the Google forms or whatever you are doing,
Yeah,
so
yes, sir.
that and don't. I think sir used to do it before, but you should not trouble him. At least as long as he's good enough to give us the data, but make sure you have to do the job. Okay.
Yes, sir. Yes, sir.
See, what you can do is, see, sir, if somebody will be going to sir now for the to assist cases and that, when they go there, if there are any new cases about whatever studies we are doing, just collect the data at that time, so that then you can enter it, and real time you can keep updating your data. Okay.
Yes, sir.
Okay. Share madam.
Yes, I do.
How many cases are you going to do for the appendix, Samir?
Um, Sir, it was 40 something, sir. I need to check this one.
Yeah, collect. See, this is because it's ultrasound, and operative difficulty. You can collect the data up to end of May, I think.
Okay,
Hello,
sir.
sir. Lakshman, sir.
Yeah, sure. We can do that. Yeah.
Yeah, you can collect data up to end of May.
Sanya needs a good machine. It's not linking.
It is linked, sir.
Where? I need to see the study now. Let's start with the study. I'm still getting the 5 papers. Should we not have 6 papers? Why are there only 5?
No, there are 10, sir. We have
Sir,
to.
there are two different slides, sir.
2
One
different
slide,
slides.
because
All
of
right.
the uh,
There are
long
10,
heading,
I
I
think,
put.
totally.
Yes, sir.
Okay.
We have 10 as of now.
We can then whittle it down to 6 at the
All
end
right.
of the.
All right. So Ines is here. So why don't you start off? Let's start off with each of the papers.
Ainas?
Yes,
Okay,
sir.
sir.
Uh, yes, so for the first paper, the audit on unplanned readmissions in the hospital.
Let it come. Let it come, Ines.
Yes, sir.
Let it come on the screen. All
It's
right,
visible, sir.
department. No, you have to gift Sanya a new laptop.
Sir, are you not able to see her
We can't see.
PPT?
We
I'm
can't see.
seeing
Ma'am,
only
share the whole screen, ma'am.
I am sharing
Not
the
just
whole
the PPT. Share your present screen, ma'am.
Yes, that's what I'm doing.
you
Now, sir?
unshare and now I can see.
Now we
Yes.
can see. Yeah, go ahead, Ainas.
Yes, sir. Sir, for this unplanned readmission, sir, I have retrospectively gone through the data. So, like in the last 1 year, the proper they had given us around 85 files, out of which the proper unplanned readmissions are around 28 cases, sir. And in the prospective, like from in this 2-3 months onwards, there are around 3 more cases which are added. So in total, there are 31 cases, and they are also providing me with the data of like last to last year, sir. So like that data is I'm still collecting, sir. So as of now, I have 31 cases of like unplanned readmission, sir.
You have to go back 3 slides. Somewhere you said underwent. You should say undergone. Go back. Yeah. Study will include patients in the Department of General Surgery who have
Yes,
Who have undergone.
who have undergone surgical intervention.
yes,
Okay.
sir. Yes,
And
sir.
have had, yeah, not underwent.
Yes, sir.
Or you
Or
can
if
say,
you want to
yeah, who underwent surgical intervention. And no, not have.
either take away have or make it undergo.
Yeah.
Yes, sir. Yes, sir.
Mm.
Yes, sir.
All right,
So,
next.
yes, sir. So for palliative
So
care,
what are
No,
what are you
what
looking?
did you find?
What are you looking so far? Just give us
How does it
the.
look? Interim
Sir,
analysis.
sir, like amongst the 31 patients that I've seen,
Just
there
hold
have
on,
been.
just hold on. You have
Yes,
the
sir.
wrong thing. Go back now, please. Go back to the previous paper, unplanned readmissions. Okay, go on.
Yes, sir. So out of the 31 papers that I went through, there were 2 cases who actually came with perianal abscess, and then they landed up with Fournier's gangrene.
Okay.
Then there are 4 or 5 who had wet gangrene of the toe, sir, like only of the toe, and they underwent reamputation, debridement, but they came back again, and like either there was amputation side debridement had to be done again, or they had 2 of them have undergone below knee amputation, sir.
Okay.
Then there are 3-4 cases of so only one case was that of patient had undergoing anterior resection, sir, and after that she came with a presentation of right supraclavicular lymph node. So that was one more presentation, and then others had like patients who have undergone appendicitis or lap coli, and they have gotten readmitted with complaints of gastritis, sir. Like ultimately, they were
But
diagnosed
what
with
about Dr.
gastritis.
Munireddy's case where he went home and came back with intestinal obstruction? That also is a readmission only, no?
Sir, but that did not fall in the category of 30 days, sir. Actually, that patient got readmitted after 6 months. So that's why I didn't include that.
No,
Like,
not that. This Reddy fellow, he
The
went.
initial surgical intervention is not there
so
for that
that was
patient, sir. He doesn't come into the inclusion criteria.
So you should have done some
Ramaswamy,
surgery. You should have done some surgery. Is that the inclusion criteria?
yes, sir. Like the first
Yeah.
admission was for surgery, and then an unplanned. The patient came again within 30 days. Like
No,
there was
I don't think you should restrict it to like that. Somebody coming with abdominal pain, distension, you discharge them. When they come back again, this time you may find something. So, sir, can we not
No,
include them
I
also?
mean, that is one possibility, I agree. But I think the idea here is, what is the morbidity of our surgical service?
That's okay.
Unplanned. That's why we are restricting our question to that.
No, but even this is unplanned only because the patient distension, abdominal pain distension, went home.
Yeah.
But then they've come back. It's a unplanned.
I mean, you can, but we have not looked at it in this paper. That's not a part of the research question.
Okay.
So we have restricted the
surgery. Okay.
Yeah,
That's
we
fine.
restricted it to surgery. Yeah.
Okay, right.
Yes, sir. And so there were around 2 more cases who again had undergone like a major abdominal intervention, maybe for incisional hernia or this, and then they have come with complaints of like a feature of obstruction, sir. All of them were conservatively managed and sent home, except for the reamputation cases, sir. And
So,
one was, yes, sir.
Yeah, get some more cases, obviously, but
Yes, sir.
your problem will be that it will be very boring to the listener if you keep listing these things.
Yes.
So we must find some way of classifying these readmissions and trying to make this dry statistics a little more
Yeah,
worthwhile.
correct.
Okay.
Yeah.
We'll think about it. Get the final data and we'll think some.
Yes,
So
sir.
I think
Think
what
of
we can do
something.
is to, this one reason for readmission, then the morbidity, and if there is any mortality, and number of hospital stay, all these things, and finances ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗುತ್ತೆ ಅಲ್ವಾ because
Finance don't ನೋಡ್ತಾ ಇಲ್ಲ ಬೇಕಾಗುತ್ತೆ.
ಆಗಲ್ಲ ಅಲ್ಲ
So
I'm
you
just
either
thinking of what are the angles you can make it look interesting ಅಂತ.
we'll look at it.
So Ramakrishna sir actually was like, when I had sent him the protocol, he had told that like once we go through the cases, then you compare each of the case with a set standard. All of these cases who like of readmissions have a set standard of incidence. So like we can compare whether the we are below
ಕಷ್ಟ ಅಮ್ಮ.
or like
Allah,
above
that
this
is a
standard.
good thought, but the problem is yours is such a myriad of the spectrum of cases is so wide that it will be difficult to say we'll control two cholecystectomies with this one with the standard and things. It will be difficult. I think we'll have to find some other way of making it look interesting after we get all the data. Okay.
Yes.
So,
Next paper,
get
Sorry.
on with get 1 more year's data quickly, and
Yes,
then
sir.
I think 2 years should be fine. If we get 50 or 60 cases, that should be okay, no, sir? Yeah. Okay. Awareness about palliative care. Yes,
Sir, 70, sir. Like I collected 5 more today. So like I have just kept a rough analysis of the pie charts from the Google form, sir. Like how many have responded, how many haven't. Like here, sir, there is a significant difference. Like most of the people don't know when to use morphine. Like what is the side effect of morphine? What is the total dose that should be given? Which patients should actually receive palliative care? What is the meaning of palliative care? And one more factor is, sir, the hesitancy, like especially in sisters, like even when I'm going to them and like collecting data from them, ensuring that there's anonymity will be maintained and everything, they're really hesitant to give the answers, reluctant, but then somehow they're giving it, sir.
No, what you do is, I would say that you conduct this, class about this, and then, ask them to answer the question. In the sense, not about palliative care per se, but what your study entails. We are not trying to judge them. We are only, instead of speaking to individual people, what you do is talk to the nursing superintendent. If you want, I can talk to them.
Yes.
And arrange for a 10 or 15-minute, lecture to them as to what your study entails. And we are not judging anybody. We are not trying to rate them. All we are trying to do is what is the current knowledge of palliative care. If you want to improve, we need to know what is the baseline. So that is all we are trying to do. Okay, I think that is better way of first one. What is your this one 100 or 150? How much is your
like 100 we had said, sir. So as of now, I have collected 70. So
right, sir.
yes, sir.
Sir,
The 30
sir, I tried to get a few from my Bangalore Medical College colleagues, and some 4 or 5 of them responded.
Okay.
Ramakrishna sir has said he'll put it in Shimoga. I put it in Surgical Society Bangalore. Not a single response was there. They are all, interested in just politics and this one. Nobody is bothered, I think. So they didn't respond. So we have to find some other way of, I think, their postgraduate groups and things like that. 100 should be sufficient, sir.
Yeah, I think so.
Then we can put it on the Likert scale and make it quantitative.
Try to do that.
Right.
Okay, go ahead.
Okay, Ainas. Carry on, Ma. I think you're doing a good job. Just make sure you collect, try and collect as many as possible. 30 more should be fine. Nurses themselves you will be able to get if you do this class and all.
Yes, sir.
Okay.
Yes, sir. Yes, sir. So this was one more protocol because the surgical site infection was scrapped out, sir, the wound protector. So I had made this protocol for like pudendal nerve block to see like in procto the bottom cases, sir. So basically it was to evaluate the efficacy of perineal blocks as an anesthetic technique. So, when we are assessing the post-operative pain relief and the opioid consumption and overall patient relief, the primary outcome was to assess the pain relief which was provided by perineal blocks in comparison to the routinely administered spinal anesthesia. And the secondary outcomes were so as to assess the duration taken for administration of anesthesia, any need for rescue analgesics, and in the post-op period, quality of life assessment in both groups. Sir, I've gone through many two papers. They are comparing between different things. So there is this one paper wherein they are comparing pudendal block with GA versus spinal anesthesia. Pudendal block only versus spinal anesthesia, and one is pudendal block administration after GA as a post-op analgesic versus spinal anesthesia. So that is what is not. I'm not able to define that, which one should be better, because
so then this will be a novel study, because if you compare the established study with pudendal block alone, then I think it's a good study. It will be. I think ask Dr. C.R. Chandrasekhar and the anesthetic PGs, and if there are any papers in their anesthetic, realm, that comparing these two, because I think you have done literature search, but you can ask them to see if there is anything more they can contribute, and then.
So Niranjan here, last time there was a concern with respect to anesthetics that they were hesitant to give pudendal block. So last time also we had prepared, just talk to CRC sir. I don't know whether they are keen, because there was some issue and some complication. PMC sir had asked them not to give pudendal blocks.
So, sir, just now they did one case, sir. They did that under GA with this laryngeal mass airway with pudendal block, sir. Just 1 week back, the anesthesia team only did it, sir.
What I am suggesting to you is, current trend in perineal analgesia is methylene blue with local mixture of methylene blue with local apparently gives good pain relief. Go through. I don't know. I've not gone through the literature. I've seen people talking about it in conferences where they're advocating that. So whether that you can compare it to any other analgesia.
Yes, sir. Yes, sir. I'll go through it.
Because pudendal block, you have to depend on them. Some people might be comfortable in giving, some people might not be. Just confirm with them. Wherever you get good numbers, you can do that. Because this infiltration, we ourselves can do.
My views are as follows. Giving pudendal block as the only anesthesia is unwelcome, basically because if the patient is awake and put it in lithotomy position and you go and poke them around in the perineum, it will not be well received. But I think what you can have is have GA with or without pudendal block for post-op analgesia. Okay? Give them all GAs.
Yes, sir.
And then randomize them.
Compare it with spinal.
Not even that. You can't compare with spinal, because spinal, if they give, or you can, let me make it this way. Make it just GA to make it simple, with half the group getting pudendal block, half the group getting analgesia, the conventional analgesia. So that your research question is pudendal block effective in giving good post-op analgesia, reduces pain score, and reduces the need for rescue analgesics. Okay, that is your research question.
Yes, sir.
It's a very simple thing. Randomization is easy. You're not dependent on, the patient's consent, of course, must be there, but I'm not bothered about the patient's sensibilities as far as, being in lithotomy is concerned, because they'll be in lithotomy anyway for your perianal operation. Okay,
yes, sir.
I would recommend that.
Yeah, I think that may be better. I think, sir, this one, give the protocol to sir also, and then
she sent it to me. I've sent you the comments, Ines, in your personal WhatsApp.
Yes,
so
sir.
make this change. Make this change, And
Yes,
the
sir.
pudendal block can be given by the surgeons. You don't not even dependent on anesthetists for this.
Yes, sir.
Okay, yeah.
Yes, sir.
And if you avoid spinal in these people, you don't have to worry whether you're giving short-acting or long-acting spinal anesthetics.
Yes, sir.
Yeah.
Yes, sir.
So just
So
plain GA, everybody
Yes, sir.
gets GA. Half of them get routine analgesics, other half get pudendal block.
Yes, sir.
Simple protocol. The
Yes.
So
strength is that
circulate
it
it
is
quickly, circulate it quickly so that both Nishant can do that in Rashtrotana and sir there, sir in SHRC, and
Yeah.
we can do it here and get at
Yes, sir.
least some 40 cases or something. 20,
Yes, sir.
20. Yeah.
Yes, sir. Yes, sir.
we do quite a lot of perineal
Perineal.
operations, so we'll be happy to participate in it. Yeah.
Yes.
Okay.
Yes.
Right. Next one. Now come to Samir. Samir.
Yes, sir.
Start.
This appendix cases, sir, 35 I have collected. Analysis is yet to do, sir. I will collect more cases. The
Need
new cases are
analysis. Okay.
yes, sir. New cases are yet to add, sir. And nursing one I have done, sir. Ma'am, kindly open it.
How many did you get from SHRC and how easy or difficult was it to get it? The data, Samir?
Easy only, sir, but then
Oh.
time and all
Meeting the living.
did not match.
What time did not match?
Like they wanted to show one case, sir. And it was late. Then I told them to bring everything.
No, I'm not with you. What was the problem? I don't.
Okay, great.
They're like the
No, I'm trying to see if I can intervene and make it easier in future. What was the problem?
like, sir, they had done some tests from outside, so they told like in this file it won't be there. But then one file which I saw, everything was there, sir. So only one case I got it that day. Then I told them to bring everything the next day. And
no, what you have to do is if it's not in the file, you must call the patient and ask for the details.
Yes, sir. These all cases, everything was there, sir. Like whichever.
No, you said there was a case where information was inadequate, right? Incomplete.
From the
So you have to
MRT
take
side,
the.
they
Let
told
me
me.
finish. Let
Yes,
me
sir.
finish.
Sorry, sir.
Let me finish. If you have a situation where some patient data point is missing, you take the telephone number of the patient from the hospital, call them and get that data point. Okay?
Yes, sir.
You have to do it. The clerks in SHRC cannot do that.
Yes.
Okay. You have to call the patient, say look, that you're doing a study and that you would be grateful if you can get this data point from them. Give them your WhatsApp or your email and ask them to take a photograph or a scan of that report and send it to you. Okay?
Yes, sir.
That effort you must put. That is the purpose of doing the study. Okay?
Yes, sir.
All right. Go on.
So, sir, regarding this nurses versus doctors note at the end. So, sir, this is the analysis, sir. Over here, the soap regimen and post-op day, and also physiotherapy. Some parameters are there, sir, which are not at all matching between doctors and nurses. So, yes, sir. I don't know what to do about this. Should I keep it or?
You have to keep it inside. This doesn't figure in the doctor's notes, whereas it figures in the nurse's notes. And on the same count, you can say these are the parameters which figures in the doctor's note, but not in the nurse's notes. So there's no comparison, right? So you first of all put that list, okay, items recorded by doctors and not recorded by nurses, one table. Items recorded by nurses and not recorded by doctors, second table. Just put two tables in two slides and then dismiss them in the sense that they're not a subject of your study because your study is comparing the two.
Yes.
And then you have certain common headings, which are jottings, which are present in both nurses and doctors. That you compare. Okay?
Yes, sir.
That will be the trend in your study. Yeah.
As of for now, sir, the group 2, which is the nursing one,
Yeah.
they are ahead, sir. From
Always. That will be the final conclusion also. Yeah.
yes, sir.
Okay. So
Yes.
next time, 2 weeks when we meet, you must have those slides where you are excluding certain items which are not present in both groups. And then you look at further analyze the differences between what is commonly present in both groups. Okay.
Yes, sir.
All right.
Thanks.
Next.
Nikita.
Sir, as of now, 3 plastic bags and 4 glove endo bags have been collected, sir.
Nikita, there must be something
There has
wrong here.
been
We do so many gallbladders. How many have we done in the last month? Let me just check.
sir, 4 glove are from SHRC only, sir.
Ah.
The problem here is recently there have been no gallbladder surgeries in Sagar.
No, I'm
The
just.
4 glove bag are from SHRC only, sir.
I'll tell you. When did you start the study?
Sir, 3 months back from December.
So, I'm going to share my screen in a second. I don't know how many I have. Just give me half a second, please. Okay. Now, can I share my screen, please? Will you permit me to do that? Oh, I can do it myself, I guess. No, I'm just trying to show you where there is an issue. Okay? Count this. This is from the first of this year. Okay? All 25 cases, 2025. That's.
We just started collecting from the last time, sir. After MD permission, we
When?
included,
Tell me
sir.
when. What date?
Sir, SHRCs are included in the March, sir.
Why? Why was it not included earlier? When did you get the permission is all I want to know.
Sir, at the end of February, there was a review meet, sir. It is when the confirmation from MD, sir, was taken.
About SHRC.
Yes, sir.
I see. All right. Okay. I have nothing more to say. Yeah. Okay.
In 2 of the cases, it was not used. Yes, sir. From then it was taken into account, sir.
You are collecting data prospectively or?
Prospectively.
Only prospectively, sir. So, because we need to know, it's an intervention study. We need to randomize prospectively and.
We had one today.
Take the timings.
Nobody came. Okay. We had one today. Nobody came. You all have my operating notes. So there must be a degree of enthusiasm and diligence in collecting data.
Sir, we thought today there were only 2 hernia cases, sir.
Did you see my notes?
Yes, sir.
Not there?
Yes, sir. It
No,
was on
one
paraumbilical
laparoscopic,
hernia,
one ray amputation and one
reamputation and
laparoscopic bilateral
bilateral
inguinal
inguinal
hernias.
hernia.
The ray amputation had lap chole. Yeah. All right. Okay.
Sorry, sir. We missed. Yes, sir.
Yeah. Let me see whether it was recorded as lap
So,
chole
sir,
or not.
there was a
Yes, sir.
there was a question raised by Lakshman, sir, about regarding the time to put in the glove inside.
Please see
But, sir,
my
if you standardize the glove to only
notes.
one
Yes,
type.
sir. Yes, sir. I
Yes.
just saw.
It says
I had
ray amputation plus lap
plus
chole.
lap chole. Yes, sir. I had
Yeah.
sent them a screenshot of only the timetable, which showed only ray amputation. My
Yeah,
mistake,
but
sir.
then
Sorry.
yesterday we discovered that he had gallstones.
Yes, sir.
last
Yes.
night we spoke to them and he agreed to have the lab quality done also, and before we added that. Yeah.
Yes.
All right. Anyway, it's good for you to check and see and include all cases. All right. Next, go on.
ಸರ್ ಇದು
But if we
ಕಂಪ್ಲೀಟ್ ಆಗೋ
standardize
ಡೌಟ್
the
ಏನೋ ನೋಡೋಣ.
sir,
ಎಷ್ಟು
sir,
20 ಕೇಸ್ ಆಗತ್ತಾ ಗೊತ್ತಿಲ್ಲ.
ಏನ್ ಮಾಡಕ್ಕಾಗತ್ತೆ, ಏನಾದ್ರು ಸರಿ ನಂಬರ್ಸ್ ಇಲ್ಲ ಅಂದ್ರೆ ಪೈಲಟ್ ಸ್ಟಡಿ ಅಂತ ಹೇಳಿ ಅಷ್ಟೇ.
ಅಥವಾ ನೆಕ್ಸ್ಟ್ ಇಯರ್ ಅದು ಕಂಟಿನ್ಯೂ ಮಾಡ್ಬಿಟ್ಟು ನೆಕ್ಸ್ಟ್ ಇಯರ್ ಮಾಡ್ಬೋದು.
Next year ಮಾಡ್ಬೇಕು. Yeah, you have to do it for next
ಇದೆ.
year.
So 10 are there anyway. Okay.
Yeah.
Okay,
sir,
Nikita,
just in case if this study,
yeah, continue
sir,
collecting data.
so one point was,
Yes,
Go on.
ma?
in case if the study doesn't make it by the end of this month, sir, I have a small study planned. I'll just share the screen, ma'am, once.
No, you continue
Sir,
collecting
because just
data, ma.
yes, sir. Yes, sir. Because 1 month, the small study which we can be done in 1 month, I was just looking
There
into
are,
it,
Allah,
sir.
you can do it, but there are already 10 studies, so we may not need to worry too much about this one. We'll see.
Sir, it's a small study about the effectiveness of diagrammatic explanation during informed consent, sir, which can be done in a month. So that I was thinking whether we can do, because it doesn't depend upon the type of surgery. It just depends upon number of cases which we collect.
Yeah.
But what are you comparing
So
it
2
to?
weeks.
Effectiveness.
Sir,
how
first
will
2
you-
weeks
With or
of the
without
month.
pictorial thing. Yeah. Go on.
So first 2 weeks, all the cases will be just taking the informed consent routinely, sir. The second 2 weeks of the month, with a printed diagram will be taken during the explanation of the informed consent. The same questionnaire for will be shared across the 2 groups, sir. It's just 1 month study, so
Is
that
that a
if there is any
validated
improvement.
questionnaire?
Yes, sir. About satisfaction of informed consent, there is a validated questionnaire,
Right.
like a blanket
Do
questionnaire,
it
sir. It doesn't
straight
depend
away.
upon the type.
Straight away, do a protocol and send it to all of us.
Okay, sir.
Don't sleep tonight. Okay.
Yes,
Draw
sir.
up the
Yes, sir.
protocol tonight
Okay,
and
sir.
send it to us tomorrow morning.
So that doesn't have to be 1
Sure,
month.
sir.
You can actually April, May, you can do
Yeah,
2
you
months.
can do it May also, 2 months.
Okay, sir.
Yeah.
Okay, sir.
Be nice to Kritika, who is our associate in SHRC. Share it with
She
her
will
and
do
see
it. Yeah.
if we can get it from our patients also.
Yes.
Yeah.
Yes, sir.
I'm away for a week from 28th. Okay. But we'll still have some cases afterwards. Yeah, go ahead. Yeah.
Okay,
And
sir.
I think Nishant will also be able to do it if you
Yeah.
ask him nicely.
Yeah.
Yes, sir.
Okay.
Sure, sir.
Next one. Ravi.
Yes, till now 10 cases are collected, sir, for both SHRC and Sagar. Out of that, 9 came as chronic cystitis, 1 was acute cystitis.
Okay. This is a prospective study, right?
Yes, sir. Yes.
Okay. All right.
There was no any central lymph node done from last meetings.
This you're not going to get
So-
numbers in this.
Yeah.
It was same 6 cases, sir.
Yeah.
2 ICG, 4 M3.
Yeah. Keep doing it, but you won't do it for this July. You won't get it.
Yeah.
Yeah.
I'll continue data collections.
Yeah.
Sir, this study is complete, and I had shared it to you, sir, and I had made the corrections.
Right.
And ma'am, the next this thing. The statistics you had asked, sir. So
Yeah.
basically, it is the pre-audit. It's basically a descriptive statistics, like the pre-audit
Yeah.
minus post-audit upon pre-audit issue.
Mhm.
So this is complete, sir.
Send it to me again. Then
Okay, sir.
we will give you a critique afterwards.
Okay.
Yeah.
Okay, sir.
Show it to me tomorrow, ma.
Yes, sir. I'll show it to you.
Okay. So Who's going to present that?
Sir, either
Niranjan.
Praveen.
Niranjan, wait.
Sir.
Who should we make it present with this one?
No, like have they selected their all of them have selected their primary paper? I don't know.
Alla madilla, but this one is ready alva. Adike we have to allot it to somebody so that they can start practicing. We should probably not give it to the first years. Maybe.
ಅದಕ್ಕೆ ಸಮೀರ್ ಮತ್ತೆ ಐನಾಜ್ ಅಲ್ಲಿ whoever doesn't have a proper paper, like primary paper, one of them can do this.
Or what we can do is, I think Praveen, ಈಗ asymptomatic gallstones ಎಷ್ಟಾಗುತ್ತೋ ಗೊತ್ತಿಲ್ಲ, ಮಿಥಿಲಿನ್ ಬ್ಲೂ ಜಾಸ್ತಿ ಆಗಲ್ಲ. I think Praveen probably should take it, alva sir?
ಮಾಡ್ಬೋದು, yeah. I leave it to you guys. Yeah, I leave it to you guys.
Praveen, you take that and.
Praveen, one doubt I had. This
Yes,
methylene blue versus ICG is for sentinel lymph node. No, it need not be breast, or it's only for breast.
Sir, breast, sir.
It's only for breast. Okay.
Yes, sir.
Okay. Because we had for that melanoma also, no?
Yes, sir. But the protocol was for breast cancer.
Okay. Fine, you can do this paper, Praveen, if you are listening.
Okay, sir. I'll do this.
And you can continue to do your other studies also. We'll decide later, whichever is coming.
Yeah.
Okay, sir. Yes.
Tanya.
Sir, if I may intervene, we have one more study that Nikita had done last time, that perianal quality of life in perianal cases. I think it has not been presented in SSB, but she has presented in state and national conference. So can we present in SSB, sir, in spite of it being presented elsewhere, like in a state conference?
I think so. You can present probably.
Yeah,
you can't present it in senior this thing, but probably you can present it in a smaller setup.
Sir,
Okay.
but minimum number of papers will be 6. No, sir, I think we already have it.
Yeah, we'll see. Keep it ready.
Ready as a standby.
Yeah.
If there
Okay,
are no
sir.
more fresh papers, we can include that.
Yep.
Okay,
I
okay,
would
sir.
agree with that. Yeah.
Yes, sir. Even stapler circumcision, last month I got 3 cases, sir. 2 open, 2 conventional, 1 stapler. Among this was the first stapler circumcision which I noticed infection in the stapler line. Otherwise, 2 or 3 I've observed with open circumcision only, sir. So this is the data as of now, sir.
It's not bad. You're getting reasonable numbers. Let's see. Yeah.
Yes.
Okay.
Okay, sir.
We'll see if we can get 2020, then it may be a good level. Let's see.
Yes, sir, yes.
You can always call it a pilot.
Pilot,
There's
sir.
no problem. Yeah.
ಆಮೇಲೆ ಈಗ ಇದು ಪೇಪರ್ಸ್ ಆಯ್ತಲ್ವಾ ಎಲ್ಲದೀಗ?
Yes, sir, yes, sir. Paper done, yes, sir.
So next one, the meeting for all this one.
Posters we have.
Posters.
I have just made the list, sir. If you can add or remove from these. So the breast lump is that Meera patient, sir, who had lymphoma.
Okay. Yeah.
So do you want to see the case? The 4 of them we have cases, sir. Rest all we are yet to collect.
We'll do it later. Finalize
Later?
the list and then we'll do it.
Okay.
This is fine. 6 to 10. I think maximum they allow is 10, is it?
Yes, sir. Sir,
Sanya, you can add that ICG
Melanoma.
melanoma I have. Oh, sorry, sir. I think I thought
Melanoma
I
you can add.
yes, sir. Melanoma is one of them. And Lakshman, sir, if you have any
I'll have to
cases.
think about it. Let me see. Yeah.
Yes,
Okay.
sir.
Yes, sir. Yes.
You can ask.
What is the gist?
Nisha.
So just is what you assisted with Munireddy sir's case, sir, ICU1. Veg
But what is the
resection.
rarity in this? Because that is a known presentation and known site for this. That is a fundus of
Yes,
the
sir.
stomach.
Nothing new in this, Ma.
Nothing
Nothing
new.
new.
Yes, sir.
And hemoglobin being low is also the
Also a same
Yes,
typical
yes,
presentation.
standard.
Yes,
standard.
correct.
Yeah. Anyway,
Anyone.
we'll have 8 or 10. It's okay.
Yes, sir. So we'll schedule a class for posters.
Next time, let them. We'll have the full presentation so that we can quickly go through them.
Sure. Okay, sir. Yes.
Okay.
Yes.
So next review meet in 2 weeks, sir.
Yeah, sure.
Okay.
Okay, 2 weeks.
Sir, Ravishankar sir, ಸಂಜೆ ಶರತ್ ತಗೊಂಡಿದ್ದಾರಾ ಒಪಿಡಿಗೆ?
ಅದೇನೋ 6:30 ತಗೊಂಡಿದ್ದಾರೆ.
ಹೌದಾ? ಓಕೆ.
ಅದೇನೋ ಮಹೇಶ್ ಅವತ್ತು ಫೋನ್ ಮಾಡಿದ್ದಾರೆ.
ನಾನು ಇದು ಮಾಡಲ್ಲ, I'll stop recording.
Yes, sir.
Yeah.